There is something you can do right now in this moment that costs nothing and takes 5 seconds. You don't need a doctor's office, a lab, or any equipment at all. All you need is a mirror or the front camera on your phone, because the tongue you see every single morning when you brush your teeth may have been sending you a warning about your liver, quietly, persistently, and without any words. And most people, including most doctors who aren't looking for it, miss it completely. Have you noticed any of these things lately? A strange coating on your tongue that doesn't go away even after brushing. A burning sensation in your mouth that has no explanation. Your tongue looks different than it used to. Maybe paler, maybe redder. Maybe there are faint lines or patches on it that weren't there a few years ago. Or maybe you've been feeling more tired than usual. Your appetite isn't what it was, and something just feels off. But every time you try to put your finger on it, you can't. Most people ignore these small changes. They tell themselves it's dry weather, or they're not drinking enough water, or it's just getting older. They brush it away, literally, and move on. But here is what I've learned in over 20 years of clinical medicine. The body is always communicating. It is always sending signals. And when the liver, one of the most vital organs in the human body, begins to struggle, it speaks. And one of the places it speaks earliest, most visibly and most consistently, is the tongue. Today I'm going to show you exactly what it's saying. Most people associate liver disease with alcohol, with late-stage illness, with something that happens to someone else. But the reality, according to the American Liver Foundation, is that 4.5 million Americans are currently living with diagnosed liver disease, and millions more have never been diagnosed because they had no obvious symptoms. The liver is often called the silent organ. It can lose a significant portion of its function before a person feels sick enough to see a doctor. That's why the 9 signs I'm going to show you today matter so much, not because they diagnose liver disease, only your doctor can do that, but because they are your body's early warning system. And if you see even one of them, it may be the most important reason you've had in years to pick up the phone and make an appointment. Stay with me. Sign number 7 is the one that stops almost everyone cold. I'm Dr. Carter Hayes, and I've spent over 20 years working with patients at every stage of liver disease, from the first elevated enzyme on a routine blood panel to advanced cirrhosis. What I have seen time and time again is that the patients who catch liver disease early are the ones who survive it in full, and the patients who miss the early signals are the ones who arrive in my office when the options have narrowed considerably. My goal today is to make sure you're in the first group. So let's look at your tongue together. Liver disease is far more common than most people realize. Globally, liver disease contributes to approximately 2 million deaths every single year. In the United States, the CDC tracks chronic liver disease and cirrhosis as a leading cause of death. With mortality rates still rising in many states, non-alcoholic fatty liver disease, which has nothing to do with alcohol and everything to do with metabolic health, now affects roughly 1 in 4 adults in America, driven largely by obesity, high blood sugar, and metabolic syndrome. What makes this so dangerous is the silence. The liver has no nerve endings that register pain the way your heart or your stomach do. It does not hurt. It does not alert you. It simply begins to fail, slowly and quietly, until one day the signals become impossible to ignore. And by then, the window for early intervention has often closed. The 9 signs I'm about to show you are that early window. Before we go through the signs, I want you to understand what your liver actually does, because it will make everything that follows make perfect sense. Your liver is the largest internal organ in your body, and it performs over 500 distinct functions every single day. Think of it as the body's central processing plant. Everything you eat, drink, breathe, or absorb through your skin eventually passes through the liver to be filtered, sorted, and processed. Toxins are neutralized, nutrients are stored, proteins, including the ones your blood needs to clot, are manufactured. Bile is produced to help you digest fats. Vitamins like B12, folate, and iron are stored in the liver and released when the body needs them. Now imagine what happens when that processing plant starts to break down. The toxins that should have been neutralized begin to accumulate in the blood. The nutrients that should have been stored become depleted. The clotting proteins that should have been made are in short supply. And where does all of this show up? In the blood that circulates through your entire body, including the blood that feeds your tongue, your gums, your oral mucosa. Think of the tongue as a downstream reporting station. When the processing plant upstream is failing, the report eventually shows up at that station in ways you can see. That is exactly what these 9 signs are. Let me tell you about a patient I'll call Adriana to protect her privacy. Adriana came to my office at 69 years old, retired school teacher, careful about what she ate, never smoked, never drank more than a glass of wine on special occasions. She came in for a routine annual exam, and she almost didn't mention it at all. "Doctor," she said, almost as an afterthought as she was getting up to leave, "is it normal for your tongue to look different as you get older?" "Mine has these strange patches on it. I thought it was nothing." I asked her to show me. What I saw prompted me to order a full liver panel on the spot. 2 days later, her results came back. Her ALT and AST, the 2 main liver enzymes, were both significantly elevated. An ultrasound confirmed what I suspected. Adriana had non-alcoholic fatty liver disease that had progressed quietly without a single dramatic symptom over what I estimated to be several years. She had never been overweight in the traditional sense, but she'd been managing prediabetes and high cholesterol for a decade, and those conditions had slowly been damaging her liver without anyone looking specifically for it. The good news, and there was very real good news, was that we caught it before cirrhosis set in. Adriana followed a structured intervention. 6 months later, her liver enzymes had dropped into the normal range. Her tongue had begun to look different too, healthier, the patches fading, the tissue recovering. On her next visit, she looked at me and said, "Doctor, I almost didn't mention the tongue. I thought you'd think I was being ridiculous." I think about that moment often, because if she hadn't mentioned it and if I hadn't looked, we might not have found this for another 5 years, and by then the options would have been very different. Before we go through the signs, I need to say something clearly, and I want you to really hear it. These 9 signs are warning indicators, not diagnoses. Each of them can have multiple causes, and not every person who sees one of them has liver disease. What they are is reason enough to speak with your doctor. Everything I'm sharing today comes from clinical literature and real-world medical practice. It is not medical advice specific to your situation, and it is not a substitute for proper evaluation by your own physician. Please take what you learn here into a conversation with your doctor, not as a conclusion, but as a question worth asking. Sign number 1, a yellow or pale yellow tinge on the tongue. The first sign is the one most people have heard of in another context, but don't always realize it can appear on the tongue itself. A yellow or pale yellow discoloration of the tongue or of the tissue underneath the tongue and along the inner cheeks. Most people know that jaundice turns the whites of the eyes yellow. What most people don't know is that it also affects the mucous membranes of the mouth, and the tongue is often the first place it becomes visible. Here's the mechanism. When the liver is damaged, it loses its ability to process bilirubin, a yellow compound that forms when red blood cells break down. In a healthy liver, bilirubin is converted and excreted through bile. In a failing liver, it backs up into the bloodstream and deposits itself throughout the body, including in the soft tissues of the mouth. The Cleveland Clinic specifically lists yellowing of the skin and mucous membranes as one of the primary early warning signs of liver failure. A yellow tinge on your tongue that does not go away with brushing and hydration over several days warrants a doctor's evaluation. Not next week, this week. Sign number 2. A persistent white coating or white patches. The second sign is one I see regularly in patients with advancing liver disease, and it's almost always dismissed at first. A heavy white coating on the tongue or white patches that don't scrape off easily can be a sign that your immune system is compromised in a way that's directly connected to liver function. The liver plays a critical role in immune regulation. When liver function declines, the body's immune defenses weaken in the mucous membranes of the mouth and digestive tract. This creates an environment where a fungus called Candida, which lives harmlessly in all of our mouths in small amounts. Research published in peer-reviewed studies on patients with liver cirrhosis found that oral candidiasis was among the most common oral manifestations of advanced liver disease. A study examining adults awaiting liver transplants found that 58% had one or more significant oral mucosa abnormalities, and white coating was among the most frequently observed findings. If you have a white coating on your tongue that is persistent, feels slightly sore or raw underneath, and doesn't clear up with normal oral hygiene, that is your body asking to be looked at more closely. Sign number 3, a smooth, shiny, almost bald-looking tongue. This is the sign that most often catches my patients completely off guard because it looks so different from what we expect a sick tongue to look like. Instead of coating or swelling, the tongue becomes strangely smooth, almost polished. The tiny bumps that normally cover the tongue surface, called papillae, begin to flatten and disappear. What's left looks almost like the surface of worn leather. This is called atrophic glossitis, and it is directly caused by nutritional deficiencies, specifically deficiencies in vitamin B12, folate, and iron. All three of these nutrients are stored and processed in the liver. When liver function declines, these stores become depleted. The tongue's papillae are among the most sensitive tissues in the body to nutritional status, and they are often the first visible sign that the liver is failing to maintain the body's nutritional reserves. Research examining liver transplant candidates found that roughly 18% had tongue papillae atrophy at the time of evaluation. If your tongue has been looking smooth, flat, or oddly shiny, and you have not been diagnosed with a specific nutritional deficiency that is worth investigating at the root cause level. Sign number 4, a deeply fissured or cracked tongue. The fourth sign is related to the third, but it presents very differently. Instead of a smooth surface, the tongue becomes mapped with deep grooves, cracks, and fissures. Like a dry lake bed or the surface of parched earth. Some patients describe it as looking like their tongue has been scored with a knife. A landmark published study examining adults who were candidates for liver transplantation found that fissured tongue was the most common oral finding, present in 37% of patients studied. That is more than 1 in 3 people with serious liver disease showing this specific sign on their tongue. The mechanism involves the same nutritional deficiency pathway as the smooth tongue, combined with reduced saliva production. As the liver's function declines, it affects the glands that produce saliva, and as saliva decreases, the tongue loses moisture and begins to crack. A fissured tongue on its own, especially in younger people, is often benign. But in adults over 60 who also have fatigue, unexplained weight changes, or abdominal discomfort, a deeply cracked tongue is one of the signs that should put liver health on your diagnostic checklist. Sign number 5. A red, swollen, inflamed-looking tongue. The fifth sign is perhaps the most visually alarming when patients first notice it. The tongue becomes distinctly redder than normal, sometimes a deep, angry red, and may feel sore, swollen, or have a burning quality that makes eating and speaking uncomfortable. This presentation is called glossitis, and it has a direct biological link to liver dysfunction. The B vitamins, particularly riboflavin, niacin, B6, and B12, are essential for maintaining the health of mucous membranes throughout the body. The liver is the primary organ that stores, converts, and regulates these vitamins. When liver function is impaired, B vitamin availability drops, and the tongue, which has one of the highest cell turnover rates of any tissue in the body, is exquisitely sensitive to B vitamin deficiency. Research on liver cirrhosis and oral health has documented tongue inflammation and glossitis as among the most common oral manifestations in patients with liver disease. A persistently red, sore, or swollen tongue, particularly one accompanied by fatigue, easy bruising, or changes in your urine or stool color, is a combination of signs that should not be waited out. I want to stop here for just a moment because we've just been through 5 signs, and I want to ask you something directly. Have you recognized yourself in any of these? A strange coating that won't go away, a tongue that looks smoother or more cracked than it used to, a persistent redness or soreness you've been meaning to get looked at but kept putting off. If any of this is resonating with you, go to the comment section right now and type the word checked. Just checked in capital letters. That's the word I want to see because that's exactly what I want you to do. Get checked. I read every comment on this channel, and if this video is giving you information you needed, hit the like button. It tells YouTube to show this to more people who need to hear it. Now let's keep going. The last 4 signs include 2 that most people have never heard of, and 1 that may be the most important of all. Sign number 6, geographic tongue. The 6th sign has a name that most patients find oddly beautiful for something potentially concerning. Geographic tongue. It gets its name from what it looks like, irregular patches of red, smooth, slightly raised tissue surrounded by whitish borders spread across the surface of the tongue in a pattern that resembles the outlines of continents on a map. These patches shift and migrate over days and weeks, appearing in different locations each time. The connection to liver health is documented in clinical research. A study involving 50 patients with active hepatitis specifically identified geographic tongue as one of the oral manifestations associated with liver disease. The mechanism is rooted in nutritional disruption, particularly zinc deficiency, which has been found to be common in patients with liver cirrhosis and which produces distinct changes in the tongue's surface architecture. Geographic tongue is frequently benign on its own and can occur in perfectly healthy people. The distinction that matters is context. If geographic tongue is appearing alongside other signs on this list or alongside systemic symptoms such as fatigue, abdominal discomfort, or changes in digestion, it becomes part of a larger picture that warrants investigation. Sign number 7, tiny red or purple dots on the tongue. This is the sign I mentioned that stops people cold, and it should. Tiny pinpoint-sized red or purple dots scattered across the surface of the tongue or the inside of the cheeks. They can look almost like someone pressed a fine-tipped pen to the tissue repeatedly. They don't hurt, don't itch, and don't go away. And they are one of the signs I take most seriously in clinical practice. These dots are called petechiae, small hemorrhages that occur when the tiniest blood vessels leak. Here is the mechanism that connects them directly to the liver. Your liver manufactures the majority of your body's clotting factors, the proteins that allow your blood to stop bleeding when a vessel is damaged. When the liver fails to make enough of these proteins, a condition called coagulopathy develops. The blood loses its ability to clot properly. And the most visible evidence of this on the surface of the body is these small spontaneous bleeds. Peer-reviewed studies on liver cirrhosis specifically document petechiae and bleeding in the oral mucosa as manifestations of this clotting disorder in liver disease. If you see these dots and you do not have an obvious explanation, a recent fall, a hard bite, an injury, they should be shown to your doctor, not after you finish this video. Today. Sign number 8, swollen purple veins under the tongue. Turn your tongue up toward the roof of your mouth and look underneath it. In a healthy person, you'll see 1 or 2 small veins running along the underside. They should be relatively flat and bluish green. What I want you to look for is something very different. veins that are swollen, rope-like, and distinctly purple or dark blue in color, sometimes with small nodule-like enlargements. This condition is called sublingual varices, and when it appears in the context of liver disease, it is a significant finding. One of the major complications of advanced liver disease is portal hypertension, abnormally high blood pressure in the portal vein system, which carries blood from the digestive organs to the liver. When the liver becomes scarred from cirrhosis, blood flow through it is obstructed. The pressure builds, and the body begins rerouting blood through collateral veins all over the body, in the esophagus, the stomach, and yes, underneath the tongue. Published case reports in medical literature have documented tongue-based varices associated specifically with portal hypertension. A study examining patients with cirrhosis found a significantly higher prevalence of these sublingual varices compared to healthy controls. If you look under your tongue and what you see looks swollen, purple, and rope-like in a way that seems unusual, that finding paired with any other signs on this list is something your doctor needs to know about immediately. Sign number 9, a burning sensation and a persistent metallic or musty taste. The 9th sign is different from all the others because it is not something you see, it is something you feel. A persistent burning sensation on the tongue combined with an unusual taste, metallic, bitter, or in more advanced liver disease, what clinicians describe as musty or sweet and stale. This taste change has a medical name, fetor hepaticus. It occurs when the liver can no longer process and neutralize certain sulfur-containing compounds that accumulate in the blood and are sensed through the mouth and breath. The Cleveland Clinic specifically documents musty-smelling breath as one of the warning signs of liver failure. When the liver stops doing its filtration job, these metabolic byproducts begin to make their presence known in the most intimate space in the body. Kamanandi anan senandadi on annadi, the inside of your mouth. A metallic or bitter taste can also result from B12 deficiency and zinc deficiency, both of which are common in liver disease as we've discussed. The combination of a burning tongue and a taste you can't explain, one that doesn't resolve when you eat, drink, or brush your teeth, is one of the most underreported warning signs of liver disease because most patients assume it is medication or a dental issue or simply something they ate. It may be those things, but it may also be your liver telling you something urgent. You have just been through 9 signs. Before we close, I want to give you 3 mistakes people make after watching a video like this, and 3 things I want you to do starting today. Mistake number 1, diagnosing yourself. These signs are warning signals, not a verdict. Each of them has multiple possible causes, and only blood tests, imaging, and clinical evaluation can determine what is actually happening in your liver. Seeing one sign does not mean liver failure. It means you have a reason to get checked. Mistake number 2, waiting because you feel fine. This is the most dangerous mistake of all. The liver doesn't hurt when it is failing. Feeling well is not the same as being well. Adriana felt fine. Her liver had been deteriorating for years. The tongue was the only surface level sign that anything was wrong. Mistake number 3, treating the tongue instead of finding the cause. If you have a white coating on your tongue, using mouthwash to get rid of it is not the same as addressing why it appeared. If you have a burning sensation, taking antacids is not a solution. These signs exist to be investigated, not suppressed. Now, 3 things I want you to do starting today. Action number 1, look at your tongue every morning for the next 2 weeks. Seriously, make it part of your routine. Hold it up to the light, check underneath it, note anything that changes. You are looking for the signs we discussed: unusual color, coating, texture, swelling, veins, or sensations. Action number 2, book a liver function test. Ask your doctor for an ALT, AST, and GGT panel. Those are the liver enzymes. Also request a bilirubin level and a complete blood count. These are standard blood tests available at any clinic. If your doctor asks why you want them, tell them you've noticed changes and want to rule out liver issues. A good doctor will take that seriously. Action number 3, write down what you see before your appointment. Date it. Describe it specifically. When did you first notice it? Has it changed? What other symptoms are you experiencing? Fatigue, appetite changes, digestion issues, skin itchiness, changes in urine or stool color? The more specific your account, the more effectively your doctor can investigate. You have spent your whole life looking out for the people you love. You took them to appointments. You noticed when they weren't themselves. You showed up for them in the ways that mattered. Now I'm asking you to turn that same attention on yourself. The 9 signs we talked about today: the yellow tinge, the white coating, the smooth tongue, the fissures, the redness, the geographic patches, the tiny red and purple dots, the swollen veins beneath the tongue, and the burning and the altered taste. None of them are causes for panic. All of them are causes for action. Quiet, calm, informed action, the kind that saves lives. Because here is what I have seen in 20 years of clinical medicine. The patients who survive serious liver disease are almost never the ones who caught it by accident in a hospital emergency room. They are the ones who paid attention to something small, who mentioned it to their doctor even when they felt slightly ridiculous doing so, who asked the question even when they half hoped the answer was nothing. Be that patient. Be the person who asked. If this video gave you something today, a name for something you've been seeing, a reason to make a call you've been putting off, share it with someone you care about, a partner, a sibling, a friend over 60 who you know hasn't had a checkup in a few years. You might be giving them the most important 5 minutes of their year. And if you want more honest, research-based health information for adults over 60, subscribe to this channel. In the next video, I'm going to walk you through 7 daily habits that quietly accelerate liver damage, and 3 simple swaps that can help reverse early-stage fatty liver disease in ways that have been tested in real clinical trials. You will not want to miss it. I'm Dr. Carter Hayes. Take good care of yourself and take good care of the people you love. I'll see you in the next video.